Multnomah County's issues with slow ambulance response times reached a breaking point earlier this month, with Chair Jessica Vega-Peterson leveling a $500,000 fine against ambulance provider AMR for just 1 month of late arrivals, a fine that AMR is now appealing. Now, I've covered this story for many months, and AMR has repeatedly denied my interview requests, instead giving me emailed statements. Not anymore. It turns out a $500,000 fine stirred up something. AMR flipped the script, and they were the ones contacting me saying they finally want to share their perspective on camera. And you can bet it's our big story tonight. The issue is a huge concern for anyone in Multnomah County because when you call 911, you expect an ambulance to arrive quickly. Why wouldn't you? But for the last 18 months, AMR has repeatedly missed county standards that are contractually agreed on. Why? A nationwide shortage of paramedics is a big reason, but not the only one. And for those of you outside Multnomah County that are wondering why should you care, AMR is the ambulance provider for Washington County, Clark County, and Clackamas County, as well among many others. Randy Lauer is AMR's Vice President of Operations, who started as a paramedic in Multnomah County and has been with the company for 42 years.
Look at all the ambulances that are parked in our bay. They should be out in the street now. If we could staff them, they would be.
AMR needs to deploy 50 ambulances a day to cover all 911 calls in Multnomah County. Right now, it can only staff 32 of them. There just aren't enough paramedics in the county. Are we now in an ambulance crisis?
Yes, we are. This system is in crisis, and it's getting worse. And it's not sustainable the way it is.
The way it is meaning Multnomah County's requirement of 2 paramedics on each ambulance. County leaders and crucially EMS Medical Director Dr. John Jew have told me they believe 2 paramedics provide better patient care. Paramedics are more qualified and experienced than EMTs. Jew says in a city like Portland with high-risk calls, that matters. But it's much more common for ambulances to be staffed with 1 paramedic and 1 EMT. AMR, a national company with 267 operations, says Multnomah County is the only place it covers that requires 2 paramedics on every advanced life support ambulance. Switching to a 1 paramedic and 1 EMT model would allow AMR to spread out its current staff of paramedics, increasing the number of available crews. It's easier to hire and staff EMTs. Plus, Lauer says this is already in the surrounding counties where AMR operates.
Clackamas County has the same paramedic EMT, so does Clark County, so does Washington County. They all produce good patient outcomes. Multnomah County doesn't have anything special over them other than they require 2 paramedics.
Okay, that may be, but those counties still report issues with AMR. Washington County is short-staffed by 6 paramedics and 5 EMTs right now. In the first 6 months of this year, AMR ambulances were unavailable to respond to 850 emergency calls in Clark County. And Clackamas County fined AMR $450,000 for late response times this summer, later voting to forgive the fine if AMR invested half of it into workforce support and retention. Still, Lauer says the 1-in-1 model is crucial to improving response in the Portland area. If Multnomah County switched to a 1 paramedic and 1 EMT model, how quickly could that change overnight in terms of how many ambulances you have on the streets?
We could staff probably 4 to 6 more ambulances tomorrow if they let us do that starting today. And within 3 months, 4 months tops, we could have all 50 of those shifts filled. About half of them would be paramedic EMT ambulances, and half would still be 2 paramedic.
Paramedic schools shut down during the pandemic, helping to create this shortage. AMR is currently sponsoring full-ride scholarships for EMTs to attend paramedic training, about $18,000 for each person. But training incentives are long-term moves. There is another reason AMR could be calling for a 1-on-1 model: money. An EMT is cheaper than a paramedic. Based on pay scales in the contract, EMTs are lesser qualified but also make less than paramedics.
Correct.
Would this be a change to cut costs and save money from a private company's perspective?
No, we didn't look at it from a cost savings perspective at all. However, there will be some cost savings just because of what you said. So we're perfectly willing to whatever savings we achieve through paramedic EMT to contribute that money back into the system.
In August, AMR expanded into Washington County, a move that Multnomah County Chair Jessica Vega-Peterson said was a big reason why she decided to fine the company. Why should AMR expand when it can't improve its current performance where it already is? I asked Randy Lauer that same question. He said AMR mostly hired former Metro West employees.
Has that spread your resources out? Are you spread too thin covering these different counties that you're pulling from one to another?
No, it hasn't. We hired most of the paramedics from the former provider and a lot of their EMTs, and then we recruited a lot of EMTs. We've really gone out of our way to avoid robbing Peter to pay Paul.
Instead, the danger for Multnomah County is more long-term. Once Washington County employees unionize, they'll be allowed to transfer between counties per AMR's contracts. Already, 12 Multnomah County paramedics have asked to transfer to Washington County. Now, there aren't 12 open paramedic positions in Washington County right now, but it shows the demand.
If we can't prevent those 12 paramedics from leaving Multnomah County and going to Washington County, that makes Multnomah more dire right away.
More dire for the people who really need help, emergency help. Here on The Story, we've shared some of those stories. A Portland man in a wheelchair hit crossing the street by a hit-and-run driver. That man died in the street waiting 32 minutes for an ambulance to arrive. Even when a federal officer was attacked at the Pioneer Courthouse in downtown Portland, there wasn't an available ambulance to take him to the hospital. But still, it's difficult to definitively say when a late ambulance changes the medical outcome of a case. And the county and AMR say they don't have proof of declining patient care, largely because fire crews still arrive to provide immediate treatment within minutes.
How are you so confident that patient outcomes haven't been affected over this last year with you not getting to scenes as quickly as you would like to?
I'm not totally confident. I just don't disagree with the chair's statement because we haven't done a deep analysis on patient outcomes. So whether or not we're experiencing those bad outcomes now, I wouldn't disagree with the chair, but we're facing them. They're going to come. We're going to start having bad outcomes.
I also talked with Robert McDonald, the operations manager for AMR Multnomah County, and I tried to talk with him about solutions. The county and AMR are clearly at odds over how ambulances can and should be staffed. Meanwhile, you, the people who live and work here, are bearing the consequences and the risk of an understaffed ambulance system, not to mention the burnout of hardworking paramedics who are covering more than their share.
Could there be a compromise here of a couple of years of allowing a one-in-one model to allow that paramedic shortage to hopefully improve and to more paramedics get trained in order to potentially revert back to the two paramedics that the county wants so much, but at least give us a grace period to get our staffing up?
That's actually, you just described exactly what we are proposing. I would say let's try it for 2 years, or let's make this happen for 18 months to 2 years. But let's start measuring data now. Let's start showing proof of concept and whether this is the course of action and it's right. A fire chief said it, I think, very well, a local fire chief, is I'd rather have a paramedic and an EMT in 8 minutes than 2 paramedics in 25 minutes, no matter what the acuity of that call is. The EMS system, as it stands now, is ready for this change, in fact, clamoring for it.
To its credit, AMR has been remarkably consistent in its messaging with me for the last year. With the current staffing shortage, company leadership truly believes a 2 paramedic system is the problem and a 1 paramedic and 1 EMT system is the solution. That's their perspective. And for the record, there's not much in terms of competition or any other ambulance company that could step into Multnomah County and do the job. AMR's been here for a while. Lauer told me directly the longer Multnomah County delays in changing its requirements, the longer this crisis will continue and the worse it'll get.
So should members of the public here in Multnomah County be concerned knowing that in those moments of crisis and emergency when seconds and minutes matter, this is a situation that is not on the track to improvement as of now?
I think they should. I think we need to be totally honest with the public, totally transparent every step of the way. And the fact is that with a system in crisis the way it is, and it going from crisis to catastrophe pretty quickly, it is going to impact them. They're going to call 911 and expect an ambulance in 8 minutes, and it's not going to get there for a long time after that, while they're with their loved one or whomever who is in dire straits. We don't want that. I mean, we all got into this career to help people in crisis. We see people at their worst days. We don't want to make their worst day worse because it takes us a long time to get there. We just urge them to make this change, make it immediately. Let us start adding more ambulances, improve the response time, get to people faster, reduce the fatigue and the burnout in our paramedics, and get back to a sustainable system.
Now that's AMR's outlook. We've previously shared the county's perspective here on the story. EMS Medical Director Dr. John Ju is steadfast in his belief that 2 paramedics save lives. I asked him for supporting evidence. He sent me multiple links to studies this week, diving into paramedic response and cardiac arrest survival rates. There's little indication that either side wants to budge on ambulance staffing, leaving you, the people who live here, caught in the middle with deteriorating ambulance services. It's why we have been so diligent about following up on this topic, and it's something we'll keep doing until response times improve and the county and AMR finally find some solution. We've extended quotes from this interview in this story on our website if you'd like to learn more. Finally, we would love to hear your thoughts on this. Should Multnomah County drop the 2 paramedic requirement? Or do you put all of this on AMR? Maybe a little bit of blame on both sides. Email the story at kgw.com or call and leave a voicemail 503-226-5090.